This is an in-service training program provided by Nutrition Care Systems. Today's topic is therapeutic diets in long-term care. Today's learning objectives are describe therapeutic diets and their use, discuss the types of therapeutic diets, and understand the benefits of providing liberalized diets. Let's start by talking about some general principles of therapeutic diets. In general, a therapeutic diet is intended to treat some type of disease or help a patient or resident manage some type of medical condition. And the planning of each therapeutic diet is generally based upon the regular diet. And examples of therapeutic diets might be no added salt, low concentrated sweets, or a renal diet. These type of diets are usually ordered or prescribed to help manage or treat some type of a disease like diabetes, high blood pressure, congestive heart failure, or kidney disease. So diabetes, doctor might order a low concentrated sweet diet. High blood pressure, congestive heart failure, then a no added salt diet may be what is required. And then if someone has kidney disease, a renal diet would be appropriate. Regular diet is a type of diet really with no restrictions, and it's generally used for residents that don't have any kind of special dietary concerns or needs or maybe any pressing medical conditions. Another type of diet is the mechanical soft diet. This diet will change the consistency of the regular diet, and this is often used for residents that have difficulty chewing or swallowing. Meats, raw fruits, and vegetables will need to be chopped or ground in order for them to swallow or chew them properly. And it's often used for residents who maybe have no teeth, maybe they're missing teeth, or their dentures are not fitting properly, or their teeth in general are in poor condition. Now, Puree diet is another example of a therapeutic diet, and this diet really changes the consistency of that regular diet to more of a smooth, soft, pudding-like consistency. The puree foods should have no lumps and not be watery. They should have a nice thick consistency. Blender or food processor is often used to prepare puree foods. And this diet is generally used for residents with chewing or swallowing problems. Clear liquid diet, we often see this in situations where people maybe have an illness, just not able to tolerate regular food. This diet allows only see-through liquids such as broth, certain types of juices, gelatin, coffee, tea, carbonated beverages, and water. So it's often used for illnesses when someone maybe has vomiting or diarrhea, or when hydration is extremely important. Now, this diet really should only be used for a very short period of time, as it really isn't nutritionally adequate. The next liquid diet is a full liquid diet. This diet allows foods which are liquid at body temperature, and it's often used as a transitional diet between clear liquids and a regular diet. So when someone's been on clear liquids and they're not quite ready to consume a general diet, often a doctor will prescribe a full liquid diet. And it's also used for residents who are just having difficulty tolerating solid foods. It gives them another option as far as food consumption. This diet also will require between meal nourishments and nutritional supplements to make it nutritionally adequate. So things that would be allowed on this diet would be ice cream, pudding, broth, that type of thing. So things, again, that become liquid at body temperature, but again, they don't have to be clear. The next diet is a low cholesterol, low fat diet. This limits the total fat in the diet as well as saturated fat and the cholesterol. It's often used in those residents or patients that have a history of heart disease, or maybe they have a history of blood cholesterol levels that are elevated. However, this diet is really controversial, debatable whether it's very effective. So it's a type of diet that we really try not to use a lot in long-term care. You may see this more in hospitals, but in long-term care, we try to avoid having this type of a diet as best we can. There are certain occasions that we might need to use this for a resident, but generally, we try to avoid having a resident on this type of diet. A no added salt diet is basically a diet that limits the amount of salt that is added after the food is prepared. So basically not allowing the resident to have any salt at the table, that they just eat the food as is. And this again is for conditions with residents with high blood pressure, congestive heart failure, that type of thing. In some cases we may limit high sodium foods such as bacon, ham, salty soups, sauerkraut, those type of things also. Concentrated or low concentrated sweet diet is often a diet that limits foods that are high in sugar or other concentrated sweets. And it's often used for those residents, patients that have diabetes. There's oftentimes that the desserts will be half portions, so they do still get a dessert but not the full portion. We'll talk briefly about providing liberalized diets and the benefits of that. Therapeutic diets certainly have their place in long-term care as far as for certain residents, but in other residents, a therapeutic diet is just not appropriate, and liberalizing the diet to like a regular or general diet is just more beneficial for the resident. For example, a resident with high blood pressure that's not eating well may benefit from just a regular diet. If they're not eating percentage-wise a lot, just a regular diet may be sufficient for that resident. Or maybe there might be a diabetic resident that refuses the low concentrated, no concentrated sweet diet. And in that case, when we talk with the doctor, it may be a case where we have to change them to a regular diet just to get them to have a better quality of life. But textured modified diets such as the Puree, the mechanical soft that we just talked about, or thickened liquids should not be liberalized unless the resident has any kind of an improvement in chewing or swallowing, and this needs to be worked alongside with the speech therapist and the physician. So that's not something that we can liberalize just because that can have an ill effect for the resident. So the speech therapist must definitely be consulted before any kind of texture modifications. If someone is on a puree diet, we can't just change them to a mechanical soft without consulting the speech therapist and the physician. That could be detrimental to the resident. So the use of liberalized diets has been associated with many benefits for the resident. Some residents, again, do not have very good intake, and so liberalizing the diet may help their intake. Some residents have unintended weight loss, and so if they're converted to a general diet, that maybe can be reversed. And then if a diabetic maybe has consistent blood sugars, that just being on a regular diet may make them happy and improve their overall quality of life. Providing liberalized diets can also help in the kitchen area because it can really simplify food preparation, not having to have all sorts of different pans of different types of foods. This is low sodium, this is low fat. It can really help simplify that food preparation area. And it also allows the resident to consume foods that they're familiar with and foods that they enjoy, maybe that remind them of their past as far as their growing up. Remember, it's up to a resident to consume the foods that they want, no matter what kind of medical condition they may have. A diabetic resident may say, I want pie and I want 2 pieces of pie, and we are not allowed to refuse that request. So if they consistently request things that are not on their diet, then we make sure we have to document that, care plan it, and then in future possibly changing their diet if that's not something they really want. And always remember too, food intake does decline with aging, so allowing residents to eat favorite foods can be beneficial. Let's review what you learned from this in-service on therapeutic diets in long-term care. And take a short quiz, 5 questions, see how you do. Question 1 asks, which of the following is a therapeutic diet? A, no added salt. B, renal. C, no concentrated sweets. Or D, all of the above. Did you get the right answer? All the above are examples of therapeutic diets. No added salt, renal, and a no concentrated sweet. Question number 2. Which of the following should not be served on a clear liquid diet? A, broth. B, ice cream. C, gelatin or jello. Or D, tea. So which of the following should not be served on a clear liquid diet? The answer is B, ice cream. Clear liquid diet can have broth, can have jello or gelatin, and tea is also acceptable, but not ice cream. Question number 3. A no concentrated, low concentrated sweets diet is generally ordered for a resident with what condition? Is it A, renal disease, B, difficulty chewing, C, high blood pressure, or D, diabetes? The answer to question number 3, a no concentrated, low concentrated sweet diet, is generally ordered for a resident with what condition? The answer is D, diabetes. Question 4, true or false? Food intake declines with aging. The answer is true. As we age, our appetite naturally declines. Question number 5, true or false? Liberalized diets make food preparation more difficult. The answer is false. Food preparation is made much easier when dealing with liberalized diets. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day.